The second part of today's video is focusing on different divisions and areas of psychology, especially as they are represented here at UNL. So you can get a feel for the different specialties that folks here on campus engage in. You can start thinking about, do I want to work with some of these people? How might I do that? What might I do with them? So you can explore a lot of those different options. The first area of psychology that I want to talk about is clinical psychology. And a lot of the time, like we said in the previous video, when we say psychologists help people, the way that a lot of us help people is through direct service provision. And part of that is through clinical psychology. So clinical psychologists assess and treat people with psychological disorders. Again, there are many different kinds of psychological disorders. So you can have your pick of what's out there. There are a lot of different ways that this happens, but in practice, when clinical psychologists practice, they assess and treat people with psychological problems. This can be grief or adjustment issues. This can be chronic disorders, schizophrenia, depression, traumatic brain injuries, anything like that. In research, they may study the development of disorders or compare different therapies to see which one works best. So if you say, I'm really interested in schizophrenia, but more than interacting with clients who have schizophrenia, I want to see what causes it, or I want to see which treatment for schizophrenia is most effective. If that's the case, then I'll probably do more on the research side of things. I give you some examples here, right? Are we looking at signs and symptoms? Are we looking at etiology, which is the development of a disorder, right? What are the underpinning causes, consequences, things like that? If you're looking at effective diagnoses, effective treatments, that sort of thing is more on the research side. So we have this idea of practice, right, in providing services to people. We have this idea of research. Where did the disorders come from? How do we treat them? Or we can actually combine them. For instance, a lot of UNL faculty members are what's called scientist practitioners, where they practice by actually working with clients, but at the same time, they also conduct research on those underlying causes and treatments. So you can potentially do both. In terms of what UNL's psychology department offers in clinical psych, we have a lot of different folks who do clinical psychology. So Trey Andrews works with mental health disparities in Latino populations. Becca Brock looks at the development of psychopathology. So if you're interested in that psychopathological piece from a developmental standpoint, right? How do kids develop it? How do adolescents develop it? She's a great person to talk to. David DeLillo does research with family violence and sexual abuse. What are the consequences in adults if you've been exposed to that as a child? Dave Hansen looks at child maltreatment and intervention. So what do we do when kids are being mistreated? How do we intervene? How do we prevent it in the first place? And how do we treat it afterwards? Deb Hope works with anxiety disorders and does psychotherapy. She also has an interest in LGBTQ issues, so she does research with that population. Dennis McChargue works with substance abuse disorders. I have to always watch myself because sometimes I want to say, Dennis McChargue does substance abuse. No, that's not where we're going with this. Let's see, Tim Nelson works with child psychopathology and pediatric populations, so he works with kids if you're interested in that. Mario Scalora is a forensic psychologist, so he works with threat assessment. He studies criminals within the criminal justice system and their psychopathology. And finally, Will Spalding works with schizophrenia, both in the diagnosis and treatment. So again, some of these people are more on the research side. Some of these people are more, nobody's like strictly only on the treatment side, on the service provision side, but most of them do a blend of both. A lot of folks are interested in counseling psychology and sort of getting clarity between what is counseling versus clinical. I can't give you any super clear boundary because there isn't any super clear boundary. The boundary is kind of fuzzy. Generally speaking, again, this is not true for every single person, but generally speaking, counselors and counseling psychology are more focused on normal variations in the human experience. So if you are looking at adjustment problems or counseling or working with kids who are having problems in school or parenting issues or marriage counseling. That's more on the counseling side of things. Those are all more counseling. On the other hand, if you're looking at I want populations who have diagnosable disorders. I want to work with people who have schizophrenia. I want to work with people who have obsessive compulsive disorder, things like that. Then you're probably potentially more on the clinical side of things. That said, it's really not as clear cut as that in real life. In fact, counselors and psychologists engage in many of the same activities. It's just that counseling focuses more on the normative functioning rather than disorders. Let's see. So again, counseling, I've talked about a lot of this. Adjustment issues, relationship issues, career choices. Career counselors are one type of counseling. So it's not just people who are having, like negative life experiences. You can also work with people who are trying to grow and explore and try things out in new ways. So it's not just this fixing problems that a lot of us are drawn to. Here at UNL, the counseling psychology folks are actually not in the psychology department. They're housed in the educational psychology department over in CEHS. The marriage and family therapy program, which is, again, separate from counseling psychology, they're over in children, youth, and families. So again, kind of depending on what you are interested in, you might be in the psychology department, you may be in the counseling psychology, you may be in educational psychology, you may be in marriage and family therapy. It just kind of depends. And I will tell you that if you are interested in going into counseling as a career, whatever institution you go to for your master's work might not have this same division. So this is sort of quirky to UNL. Different schools do it differently. So just a heads up about that.